Before using this medication, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Remember to prime the inhaler if it's your first time using it, if you haven't used it for a week or longer, if you dropped it, or if you put the canister back after cleaning. When priming the inhaler, spray away from your face to avoid getting the medication into your eyes. Shake the inhaler well before using it. Inhale the medication as directed by your doctor, usually twice daily in the morning and evening. Wait at least 1 minute between each inhalation. To prevent dry mouth, hoarseness, and oral yeast infections, rinse your mouth with water and spit it out after each use. Do not swallow the rinse water. Use this medication regularly to get the most benefit from it, and try to use it at the same times every day. Do not change your dose, use this medication more often, or stop using it without consulting your doctor first. If you are using other inhalers at the same time, wait at least 1 minute between each use. If you are also using a different corticosteroid taken by mouth, do not stop using it unless directed by your doctor. You may experience withdrawal symptoms if you suddenly stop the medication. Your doctor may direct you to slowly lower the dose of your old medication after you begin using this product. If you have been using a quick relief inhaler on a regular daily schedule, consult your doctor to determine if you need to make any changes to your inhaler use. Lastly, if your condition does not improve or worsens, make sure to inform your doctor. Some common side effects of using this medication include dry or irritated throat, hoarseness, or coughing. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Using this medication may lead to an increase in your blood pressure. It's recommended to monitor your blood pressure regularly and inform your doctor if the results are high. Although rare, this medication may cause sudden severe wheezing or difficulty breathing right after use. In such cases, it's important to use your quick relief inhaler and seek medical help immediately. Notify your doctor right away if you experience any serious side effects, such as white patches on the tongue or in the mouth, signs of infection, difficult or painful urination, muscle cramps or weakness, increased thirst or urination, bone pain, changes in mood, or shaking, tremors. Seek immediate medical help if you experience very serious side effects, including chest pain, fast or irregular heartbeat, severe dizziness, fainting, eye pain or swelling, redness, or changes in vision. While very rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects. If you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects and report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report any side effects to Health Canada at 1-866-234-2345. Before using this inhaler, it's important to talk to your doctor or pharmacist about any allergies you may have to budesonide, glycopyrrolate, formoterol, or arformoterol, as well as any other allergies you may have. This inhaler may also contain ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have or had infections, heart problems, high blood pressure, seizures, bone loss, eye problems, overactive thyroid, diabetes, difficulty urinating, or liver disease. This inhaler may affect the heart rhythm, causing serious symptoms that need immediate medical attention, so it's important to discuss with your doctor or pharmacist if you have certain medical conditions or are taking other drugs that may cause heart rhythm problems. Low levels of potassium or magnesium in the blood could also increase the risk of heart rhythm problems, so it's important to talk to your doctor about using this inhaler safely if you have conditions such as severe sweating, diarrhea, or vomiting, or if you are taking certain drugs. This medication may mask signs of infection, making it more likely for you to get infections or making current infections worse, so it's important to stay away from anyone who has an infection that may easily spread and to talk to your doctor if you have been exposed to an infection. If you have recently switched from a corticosteroid taken by mouth to this inhaler, or if you have been using this product in higher than usual doses for a long time, it may be more difficult for your body to respond to physical stress, so it's important to inform your doctor if you are having surgery, emergency treatment, or if you get a serious illness or injury. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If this medication is used for a long time in children, it may temporarily slow down their growth, so it's important to see the doctor regularly for height checks. This medication may also affect older adults more, especially in relation to heart rhythm problems. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Budesonide passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Budesonide 160 Mcg-Glycopyr and 9 Mcg-Formot 4.8 Mcg/Actuation Fa inhaler, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's also important to avoid using other LABA drugs, such as arformoterol and salmeterol, while using this medication. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much of this medication and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include shaking, tremor, chest pain, fast or irregular heartbeat, severe dizziness, and seizures. It's important not to share this medication with others. While using this medication, it's essential to undergo lab and/or medical tests, such as lung function, blood pressure, pulse/heart rate, and eye exams. It's crucial to keep all medical and lab appointments. To improve breathing problems, it's important to avoid smoking and other factors that can worsen breathing problems. It's also essential to consult with your doctor or pharmacist about getting a flu shot every year, as the flu virus can also exacerbate breathing problems. For adults using this medication long-term, there may be an increased risk of bone loss, osteoporosis. It's important to discuss this risk with your doctor and inquire about available treatments for osteoporosis. Making lifestyle changes, such as increasing weight-bearing exercise, quitting smoking, limiting alcohol, and consuming well-balanced meals with adequate calcium and vitamin D, can also help promote healthy bones. In some cases, calcium and vitamin D supplements may be necessary. It's important to consult with your doctor for specific advice. It's also beneficial to encourage children to exercise and eat a healthy diet to help prevent osteoporosis later in life. If you happen to forget a dose, just take it as soon as you remember. But if it's almost time for your next dose, it's better to skip the missed one. Don't try to make up for the missed dose by taking double the amount. Just stick to your regular schedule. When using Budesonide 160 Mcg-Glycopyr and 9 Mcg-Formot 4.8 Mcg/Actuation Fa inhaler, it's important to store it at room temperature, away from light, moisture, and heat. Make sure to keep it in the sealed pouch until you're ready to use a new inhaler. After opening the sealed pouch, throw away the inhaler 3 months, or 3 weeks if using the 28 inhalation product, or after the last dose is inhaled, whichever comes first. Remember to keep all medications away from children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of the inhaler, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.